day. Welcome to Penang Adventist Hospital WAW Journey. I'm Tian, and today we'll be talking about prevention of cervical cancer. Cervical cancer has recently been ranked as the third most frequent cancer among women in Malaysia, and it is the second most frequent cancer for women of childbearing age. Currently, it is the most preventable cancer due to more specific screening guidelines and innovation in testing. So to have a clearer view on today's topic, we have invited Dr. Diong Seng Kwok, Consultant Obstetrician and Gynaecologist of Penang Adventist Hospital, to be with us here today. So Dr. Diong, welcome and thanks for coming.
Good afternoon, Tian. Thank you for inviting me. It's my pleasure to be here.
Dr. Diong obtained his medical degree from the National University of Ireland in year 2001, and he continued to complete his master degree in obstetric and gynecology in University of Malaya. He is the recipient of the Excellence in Service Award from the Ministry of Health Malaysia in year 2008 and 2012. Other than practicing in Penang Adventist Hospital, he is also a clinical tutor in RUNC. So Dr. Diong, can you help us to understand what exactly is cervical cancer?
Well, cancer is a disease in which cell grows out of control. It is normally named after the organ that it started, even though later it spread to other body parts. As the name implicated for cervical cancer, we know that it is started from the cervix. Just to show you, the cervix is actually located in between the vagina and the womb. Vagina is the birth canal and the womb is where the baby grows when you are pregnant.
I see. So is there any symptoms that a woman should look out for?
There is rarely any symptoms in the early stage of the disease. However, when the disease progresses, symptoms will start to appear. What common symptoms you will experience is the abnormal vaginal bleeding, sometimes associated with foul-smelling discharge. You can have bleeding after menopause, sometimes associated with lower back ache. Other symptoms include pain during sexual intercourse, and the most important symptoms that you need to seek treatment is bleeding after sexual intercourse. However, in advanced stages, you will have leaking of urine and feces from the vagina. However, you would not wait until this stage. Only then you will seek treatment.
I see. So how does cervical cancer develop?
Cervical cancer is actually a very slow-growing cancer. The cells in the cervix undergo abnormal changes and will take several years to grow into invasive cervical cancer. And sometimes it takes almost 10 to 15 years to grow into invasive cancer. The changes in this cell is actually called the precancerous changes. Because of this long window period, there are actually many opportunities for early detection and treatment. Hence, it is very important to undergo a routine pap smear to detect all these abnormal changes, which could be in silence.
So what are the risk factors for cervical cancer?
The most important risk factors is actually associated with the infection of HPV, which stands for human papilloma virus. If you are having HIV or other condition that makes your body weak, you are more prone to have cervical cancer. If you are smoking and using birth control pills for longer than 5 years, you have the increased risk of cervical cancer. If you have given birth to 3 or more children, and the most important risk factors is having several sexual partners or becoming sexually active at a very young age, increases your risk of cervical cancer.
I see. So talking about HPV, Dr. Diong, can you help the audience to shed some light on what HPV is?
HPV stands for human papilloma virus. It is almost associated with all the cervical cancer. It is passed through from one to another during sexual intercourse. There are many types of HPV, and not all the types will actually cause cervical cancer. Some will cause genitalia or skin wart. HPV is so common that most people get it at some point of time in their life. HPV usually causes no symptoms, and you can't tell whether you will actually get infected by HPV virus or not. One good news is most of the women will get rid of the HPV by herself. If there is persistent infection of the virus, it increases the risk of cervical cancer. There are 14 strains that is associated with cervical cancer, and the main one is type 16 and 18.
Okay, since cervical cancer takes a long time to develop, hence it's actually very highly preventable, right, doctor? So what are the types of screening methods that is actually available?
One of the screening method that is popularly known as pap smear or HPV testing. What normally pap smear do is you obtain cells from the cervix, and it is a very simple and fast procedure. Normally, when you see a doctor, you will be asked to lie on the couch. A speculum will be inserted into the vagina and it's open to look at the cervix. Firstly, the doctors will be looking for any abnormal growth around the cervix. If there is none, cells will be taken from this cervix by a brush. After taken the cell, this brush will put into a special medium and subsequently sent to the lab for testing. For the pap smear, normally the lab will be looking for any abnormal cells that is present. For the HPV test, samples are tested for the presence of any high-risk HPV types. You can also do a self-collected HPV testing, which is available in our hospital.
So now we have a clearer picture on what cervical cancer is and the available screenings. So let's further discuss on the prevention part. So talking about the HPV vaccination, Dr. Diong, who is eligible and when do they need to take this vaccine?
The HPV vaccination is recommended for the age of 11 to 12 years old girls. However, if you haven't been vaccinated during that period of time, you can still go to the doctors to get injection up to the age of 26. Some adults at the age of 27 to 45 years old may want to discuss with their clinician the need of this vaccination. Most of the vaccination will be given in 2 injections for those girls that is less than 15 years old, and you will need 3 injections for those more than 15 years old over the 6 months period.
So there are actually some misconception and myth about this cervical cancer screening and the vaccination. So shall we address some of it? So the first myth is if a woman gets HPV vaccine, she no longer needs to do pap smear. Is that true, doctor?
That is not true. Girls and women who already get vaccinated will still need to be screened for cervical cancer with either pap smear.
So the second myth is I don't need to get screened because I don't have any symptoms. So is that true?
Screening test is actually to find out any abnormal things that is happen in your body even without symptoms. As I said earlier, early stages of cervical cancer has no symptoms. Hence, it is better to have screening to detect all these abnormal changes and seek early treatment if it is present.
So the third myth is if I have HPV, you will develop cervical cancer.
It is not true.
Okay.
We now know that HPV has more than 100 types, and some are associated with cervical cancer. What we know now is most of the virus will be get rid of from our body within 2 years. In some cases, if the virus persists in our body, then it will cause abnormal cell changes and increases the risk of cervical cancer.
So the last myth we're going to address is cervical cancer hereditary?
No, cervical cancer is not hereditary like what breast and ovarian cancer. What we know now is it is mainly caused by the HPV infection. So in order to save child from infection, please make sure your child will get HPV vaccine. If you are too old to get HPV vaccine, make sure you get regular HPV and pap smear tested.
Okay, so thank you so much, Dr. Diong, for today's sharing. I believe everyone learns a lot from you.
It's my pleasure to be here. I would like to remind two things I would like to remind the audience. The first is cervical cancer is completely preventable disease with a rate up to 93% according to the CDC. While most of the undetected cases are attributed from women didn't participate in the cervical screening. The second thing that I would like to remind the audience is that patients should avail to healthcare provider, preferably the gynecologist, to participate in cervical screening. This way, we can prevent this disease together. Therefore, I would encourage all women to be involved, educated, and informed about their own healthcare choice.
I see. So once again, thank you so much for Dr. Diong to be with us here today. And that's the end of today's session. And stay tuned for WAW Journey for more health topic. For more information on the various tests and vaccination in Penang Adventist Hospital, please visit Adventist Lifestyle Center or call 04 222 779. Thanks for watching. Bye-bye.
Bye-bye.